Communities are powered by their networks and connections. Sharing information, skills, and perspectives enables people in those communities to take complex problems and find solutions. But for organizations, there are often gaps in our communication that limit our connection to each other. And when we aren't connected, it makes it harder to provide services and care to those who need it most. For example, let's say this is Maya, and Maya shows up to a health center, and while community health worker Alicia conducts a needs screening, Maya explains that her food benefits have recently run out. Alicia takes a few minutes to research local food resources, and after a few minutes of searching, she finds an address to a food pantry that she passes on to Maya. So Maya travels to the pantry, but unfortunately, it's not a food distribution day. So she travels home and researches the food pantry's distribution hours and compares them with her own schedule. On her day off, Maya again makes the trek to the pantry and starts another client intake process. When the pantry coordinator hears that Maya is struggling with rent, he does his best to search for agencies that could be relevant to Maya's situation. Eventually, he provides a phone number to Maya. Later, when Maya calls the number, she's asked to again share her story and personal information. Unfortunately, Maya doesn't qualify for assistance at this agency, but she's given another phone number for a separate agency that might be able to help. There is an enormous opportunity to improve the way people are connected to resources by strengthening how organizations share information. Created, owned, and informed by people and organizations like you, a community information exchange is a model first developed by 211 San Diego that helps organizations better serve people. It's not just one centralized database or a specific software. It's a unified network of partners, connected by an infrastructure that supports them and providing coordinated, dignified, and seamless care. It does so by increasing exposure of social and health services through a shared resource directory. It allows a client's profile to be matched to available services they are eligible for, enabling information sharing and managing consent to safeguard privacy. Building on the foundation of 211 and existing relationships, organizations across southeastern Michigan are joining together to create our own community information exchange, Connect4Care. Now here's how Maya's story plays out with Connect4Care. As Alicia learns that Maya's food benefits have recently run out, Alicia can quickly search and find an eligible food pantry only a few blocks from Maya's house. With Maya's go-ahead, Alicia books a new client appointment on the spot, and Maya receives an email with the date of the appointment, along with required documents and the address and phone number of the location. And later, when Maya arrives, the pantry coordinator already has Maya's information from what was collected by Alicia. And when Maya mentions that she's having trouble with rent, the pantry staff can quickly find resources that Maya qualifies for, can see which agencies are accepting new clients, and easily send over a referral. But what's potentially the most exciting is that this is happening across the entire community, helping us understand in real time what needs exist and where networks and connections are working well. Now community members and organizations can work together to advocate for policies and resources that in turn create impact and over time change the system to be more equitable. If you'd like to learn more or join the CIE efforts, visit unitedwayscm.org/CIE.